Hey there. One of the questions I often get is, how do I manage chronic pain without medication? How do we do that naturally? And for a lot of folks, if you're used to the primary care system and you're used to taking medications, that can be a little bit uncomfortable because we've been conditioned into this way of doing medicine essentially and approaching health in a certain way. And so, one thing I want to clear up for most people is that most of your pharmaceutical medications come from herbal medicine. For example, red yeast rice is known as Honghua in Chinese medicine. It's been around for 4,000 years. And that's been developed and used in our modern statin medications. So, what they do is they take that herb and they make it 200 times stronger in the lab, which suppresses your cholesterol numbers on your lab test, but it also causes your side effects, which usually increase muscle and joint pain and brain fog and low energy. So, that's the first misconception, is that your pharmaceutical medicines are many times coming from a natural herb. They've just had to change it because you can't patent nature. They patent pharmaceuticals that are, artificial ingredients and synthetic ingredients into a medication. So that's the first misconception. Most of our medicines actually come from the plant world. They've just been sort of taken over, if you will, in the last 120 years with the pharmaceutical industry. But the bigger question is, well, what do I do? I don't want to take medications, or I'm open to other ways of treating my pain. So that's the biggest misconception, is what's out there. I just don't know. There's some ignorance around that. We're not really taught these things. We're just taught, go to the doctor and get your prescription. So that's one thing. But a lot of times our herbal medications are actually more effective, and they're a lot safer long term, and they work on some of those same inflammatory pathways in the body. So for example, things like turmeric, for example, and resveratrol, these work on our COX pain pathways. These are the same things that your ibuprofen does, or some other drugs do. Is your COX inflammatory pathways are what lead to the pain that you're feeling. So we have herbal compositions that have been around for centuries that address the same mechanisms. They work at the same receptor sites. They're just natural. Okay, so that's usually the biggest thing. Is sometimes you do have to take a little bit more than one pill, because again, these are natural plant and mineral substances. So we may have to take more of it, whether it's in capsule form or in a powdered form or a liquid form. We're all used to a pill. That's a bigger difference, right? So maybe having to take a little bit more of it. Maybe having to be a little more patient. Things don't always happen as quickly with herbal medications. They happen, but they don't happen overnight. For those of you that may have had cortisone, for example, you know what I mean. I had an experience with that myself. I have an autoimmune condition, had a lot of trouble with my bowels, and had to get some attention. And it was an acute flare-up. I took a steroid overnight. Wow, amazing, right? It reduces inflammation. I was able to have a bowel movement right away. Those drugs are there for that reason, right? They're for acute care. They're for these emergency conditions. But it's when we start using them, consistently and chronically over time, we have problems, particularly with our opiate crisis, right? Oxycodone and those types of drugs are highly addictive, and they're really hard to get off of. So some of the biggest misconceptions are, how do they work? Where do they come from? How long do I take them? How much do I take? And those are really individualized questions. We usually start with a standard dose of something, and sometimes we have to increase it or lower it depending on the person. But they are coming from the natural world, and so a lot of people just prefer that. So hopefully that clears up some of the common misconceptions of where they come from. Are they safe? And those types of things. So this is Dr. Lane with Elemental Natural Medicine. Click on the link below if you'd like to come into the clinic for a complimentary consultation to discuss your health in more detail.